For ETSU senior Courtney Fletcher, becoming a nurse is quite the privilege.
Very humbling to help someone who maybe can't help themselves, and just to see the progression of them getting better, being able to touch their lives and heal them and love them through that when they might not have anybody else to do that.
However, the landscape for medical care is rapidly changing in her region of East Tennessee. Mountain States Health Alliance and Wellmont Health Systems are merging into one company called Ballad Health as early as this coming January. ETSU Dean of the College of Nursing, Dr. Wendy Nehring, explains why.
They have been in competition with each other for a number of years. Well, with all the changes in healthcare and reimbursement and the like, they were running into financial issues. Not that any of them were ready to close the doors or anything like that, but they could see the writing on the wall that things weren't getting better.
While the decision to merge will in a sense create a monopoly on the healthcare system in East Tennessee and Southwest Virginia, management and administration will still remain local. Had the two companies decided not to merge, a larger company would have taken over.
You would have people that are managing all of this from a distance. You wouldn't have the same, perhaps, local atmosphere where the people taken care of, the people you grew up with, or the people you knew that lived down the street. And to use the phrase, it probably would have become much more corporate.
According to the Johnson City Press, approximately 250 jobs will be lost when the merger comes to completion. These will be administrative positions and will not directly affect nurses like Fletcher, who want to stay in the area. Fletcher is in her third year as a nurse intern at Niswonger, and she hopes to receive a full-time position after she graduates.
Part of working with kids, they are so resilient. They don't have as many turnaround rates as adults do, and they're just more fun. Like, I get to blow bubbles and read stories and play outside with kids, and you don't get to do the same things with adults as you do with them.
Fletcher is in her third year as a nurse intern at Niswonger. She hopes to continue working there, even if Ballad Health makes some drastic changes. The merger website, becomingbettertogether.org, notes that there is potential for reductions in pay.
I have a big family back in Greenville, and I could not go much farther probably than Johnson City, not being able to see them. I'm just a very family-oriented person, and I love to be near them and to watch my siblings grow up. And so I am not very willing to go much outside of East Tennessee just for the sake of finding a job that would meet my pay needs and my living costs and expenses.
Only time will tell if Ballad Health will reach its goal of becoming one of the best healthcare systems in the nation.